Hello, so this is a distance tutorial on the muscles in light of your upcoming muscle practical. Your muscle practical will be in the laboratory and you will be using muscle models in the practical. I do not have an exact copy of the study guide and instructions you were given to prepare for your practical. So this muscle tutorial may be lacking some of the things on that guide, or maybe including some things that are not on that guide. But overall, it should generally be similar to the things listed on your guide. So in your practical, you will probably need to be able to identify the location of muscles, including their names and how to spell them, possibly their origin or insertion, their action. In light of the naming that I said, to be able to name the muscles and properly indicate their location, it always helps to pronounce them and spell them. So as we go through this video tutorial, feel free to kind of, like, if you're somewhere where you can talk or make a little bit of noise, feel free to just like try to say the muscle names yourself. Pause at any time to try to write out or spell the muscle correctly from memory. Maybe quiz yourself along the way, either before or after I address something. Both is always good. The more you review it, the more likely you're going to remember it. Okay, so for this tutorial, I will be identifying the location of muscles, and then as we go through, I'll give different tips. Some tips about action, some tips about origin or insertion, some tips about the naming and how to use the terminology of the name to your advantage in the practical. These images are some that I found from Google. They're not my own. But I found these ones and I used these ones because they are, most of them are actual images of muscle models themselves and not just a drawing. A couple of them are drawings, but I tried to find drawings that looked similar to muscle models themselves, because in the practical you will be using models, not drawings. You have a copy of this, of the unlabeled images. So before we begin, I'd like you to pause the video if you have not already attempted to label these muscles on your own. So you'll want to do two things. For each image, you'll want to get your bearings. So look at the image and declare what you're looking at. And then declare how you're looking at it. From what view are you looking at it from? And after you do that, go ahead and try to label the muscles. After you do that, go ahead and come back to the video and we'll go through these muscles where you can review your answers and note any tips that I say along the way through this tutorial. Additionally, you probably already know this, but I just want to point out that this tutorial is of images, right? They're photographs of models, whereas in the practical you will have actual models. So there are multiple images of the same, like a better way to say that is one muscle may be shown or depicted on multiple images. So you may be able to see the muscle posteriorly and anteriorly, but you need to be aware of how you're seeing it. And So if you're looking at a medial muscle, of course it's still going to be the medial side of like the lower extremity on both views. But when you look at it one way, it's going to be like right or left, depending on if you're seeing it anterior or posterior. That may or may not have made sense. I apologize if it didn't. I rambled a bit there, but you'll see what I'm getting at as we go through this. So we're going to go ahead and begin. So if you haven't already done the pausing and tried to work through this on your own, go ahead and do that now. If you already have, that's great. So let's get started. So what are we looking at? We're looking at a lower extremity. We are looking at an anterior view. And if we go down, we see where our big toe is. We know that we are looking at the left lower extremity. So the big toe is medial. That lets us know how we're looking at this. So that is our left lower extremity anterior view. Let's go ahead and note that this is the lateral side. I will do my best with this pen throughout this tutorial. Sometimes it can get a bit wonky. It is not a great touch screen, but it does the job. So that is lateral, this is medial. Okay, so we know that lateral, medial, and then we have proximal. And we head distally as we go away from the body, right? So down toward our feet. Distally. Okay, so we'll go ahead and start talking about these muscles. We'll start on the lateral side and proximal, and we're going to head distally. Okay, so the first muscle that we will note is the psoas major. And then we have the iliacus. Next is the tensor fasciae latae. This is a good one to note about the terminology. So you can actually use the name to help guide you to determine what the action is for this muscle, the tensor fasciae latae. So tensor means to stretch or tighten some part of the body. So if you're in your practical and you can't think of what the action is, you can use the words to guide you. So the next muscle is the longest muscle in your entire body. It's the sartorius. Lateral to the sartorius is the rectus femoris. Rectus means straight muscle, and femoris is referring to the femur. Or I'm sorry, rectus doesn't mean straight muscle, but rectus is referring to a straight muscle, and then femoris is referring to the femur. So another one where you can use the name, if you were given the name rectus femoris and you had to find it, go find your femur, and you know it's going to be a straight muscle on top of your femur, right? So definitely use the terminology and nomenclature when you can. Lateral to the rectus femoris is going to be the vastus lateralis. And again, we're on the lateral side. It's the most lateral muscle there, vastus lateralis. That makes sense, right? Okay, so let's head medial, and we're gonna stay lateral. We're gonna go from the thigh down to the leg now, okay? So we're going to review the tibialis anterior. Tibialis referring to the tibia, anterior referring to the front of the lower extremity, right? Extensor digitorum longus is next. So extensor is referring to extending or straightening the limb, and digitorum is referring to the digits or your toes. So now we're going to head medial and back up proximal. And we first have the pectineus. I erased a little bit of the medial there, sorry, pectineus there. Inferior to the pectineus is the adductor longus. So We can use that name to help guide us if you are absolutely unsure of what the action is. Adduction or adductor, we're talking about moving toward the midline. So you can use that word if you're in your practical, you need a little clue of what this does. That's what adduction means. Okay, so we're moving toward the midline. Next up is the gracilis. Go ahead and just like make a mental note of the gracilis and where it is. We're on the medial side, because in the next image, actually multiple of the muscles that we're addressing, you can see again in the next image in the posterior view. But just, we're gonna kind of use the gracilis as a landmark muscle. So we're gonna talk about it again in the next image. So just note where you see that here. Okay. Next we have the vastus medialis. Medialis referring to the medial side. So we're on the medial side of your lower extremity. We're going to go from the thigh down to your leg now. We have the gastrocnemius. And lateral to, or I'm sorry, medial to your gastrocnemius is going to be your soleus. Right there. Okay, so that is our first image. We're going to move right along. I'll say as I'm scrolling here, if you have any questions or if you're confused about anything that I say in this video, or if I misspeak about something, I hope I don't, but if I do misspeak about something, anything of the sort, please know that you can always call, text, or email me with questions, or write them down and then just bring them to our next meeting, anything like that. So my goal is to reduce confusion, not create confusion. So please let me know if you have any questions. Okay, so what are we looking at? I hope you already attempted to figure that out. If not, go ahead and pause and come back to us. So right now we are looking at the posterior view of the left lower extremity. So we'll go ahead and we'll label. We have medial and we have lateral, right? Okay, so as I told you earlier, these are not my images. I found these great photos on Google. There's a little note on the top that says gluteus maximus removed to expose sciatic nerve. So as you can see on the lateral side, we have an arrow pointing to the sciatic nerve. That note is just indicating that normally you would not be able to see that if the gluteus maximus was visible in this photo, in this model. Okay, so let's start medial, and we're going to start medial proximal, and we're going to head distally. Okay, so first up we have the adductor magnus, and the semitendinosus is already labeled. Then we have the gracilis. So remember that I asked you to kind of make a note of this in your brain on the last image, the gracilis. We saw it in the last image, and it was on the medial side. But if you're thinking, no, it wasn't, it was on the lateral, it was on the lateral side, because now we're looking at the posterior view. So before, it was, of course, still on the medial side, but the anterior view. So our sides have swapped now. So when we were looking at anterior, we had the medial on the left side of the screen and the lateral on the right side of the screen. But because we're looking at a posterior view now, we have the lateral on the left side of the screen and the medial on the right side of the screen. So just be aware, you can still see the gracilis. The gracilis has not moved on the leg, it is still there, but you're looking at a different view of the leg. So that's why it's important when you're in your practical and you're holding the model in your hand, or you're touching some part of the model, make sure you know what view you're looking at the model from, because it can really throw off how you identify where the gracilis is. So if you're holding the leg, It's not always going to be to the left. You got to know which view you're holding the leg from. Okay, so I really want to make a point of that. So beneath the, or I'm sorry, not beneath the gracilis on the leg, but labeling beneath the gracilis, you see some semimembranosus. And then the next muscle labeled, and it is the biceps, I'm sorry, not the biceps femoris, it is the sartorius. So again, we saw the sartorius in the last image, and what is the fun fact about the sartorius? It is the longest muscle in the body, so hopefully you remember that. Okay, if we head to the lateral side and we go back proximal, we cannot see the gluteus maximus, as it's been noted, but we can see the gluteus medius. We can see the sciatic nerve. We can see the biceps femoris. So femoris, we addressed that that is referring to the femur. And if we head from the thigh down to the leg, we have the gastrocnemius there. I'd also like to note that the lower extremity, or for any extremity, but just for this image, I'll just point out. So we have, you can see the side that's labeled medial and the side that's labeled lateral, and that is referring to the entire leg. But if we are talking about the muscles, like you see how they're kind of like lined up there on your thigh, you can refer to like individual muscles too. So if you see the semitendinosus there, it's kind of in the middle. And then we have the gracilis here, and then the biceps femoris here. So if we were talking about the relation of the semitendinosus in relation to the biceps femoris or gracilis, the semitendinosus is medial. So just know that medial is always referring to the middle. Yeah, don't let that confuse you either. Okay, I hope that made sense. If not, reach out to me and we'll talk about it more. Oh, and then, so if the semitendinosus is medial to the gracilis and biceps femoris, then the biceps femoris and the gracilis are lateral to the semitendinosus. So, okay. So moving on, if you don't have your bearings, go ahead and pause and get them. We are looking at the dorsal view, or the posterior view of the trunk. Okay, so let's figure out where we're going to begin. We will start, let's see, we will start on the right side of the body. Okay, so the first muscle that we will label is the levator scapulae. Then we have the supraspinatus muscle. So let's go ahead and think about the supraspinatus muscle. Where are you going to find that? You're going to find it on the supraspinous fossa of the scapula, right? So we have the spinous process of the scapula that separates the supraspinatus muscle and the infraspinatus muscle. So right here in pink, I will highlight that, the spine of the scapula, right? So the spinous process of the scapula. And so that separates. So we're going to have the supraspinatus muscle superior and the infraspinatus muscle inferior. So with all of that said, I think we know that this is the infraspinatus muscle. Labeled again there, pink. So infraspinatus muscle here. Next up we have the teres minor and teres major. So just like on the facial muscles, how the zygomaticus minor is superior to the zygomaticus major, the teres minor is superior to the teres major. So we have teres minor and teres major right there. Okay, we'll head to the left side of the body. And we know that our big kite shape is the trapezius. Next we have the deltoid. If we just think about, I like this image because we can see the muscles, but we can also see some of the skeletal system. And we always know that skeletal muscles are inserting and originating on the skeletal system, and their action is going to be to move skeletal muscles, right? So they are related. So I like that we can kind of see some of our bones there. So the deltoid is going to originate on the clavicle and the scapula. And you can kind of see that there. So you can see your scapula. You can see your scapula here, if it will let me do a little highlighting. Oh goodness, I have a little technical error, I hope not. Okay, give me one moment. There we go. So we have our scapula in pink there, and then and then we, you can't really see it well, but our scapula, or our clavicle would be about right there. So our deltoid originating on our clavicle and scapula, and then inserting right here on our humerus. Also, let's note that what is the white stuff we're looking at? It's tendons. Tendons connect bone and muscle, right? So you can see the little tendon right there connecting our deltoid to our humerus. And then if you just think about, where is the deltoid originating? We said clavicle and scapula. Where is it inserting? We said humerus. So what is the action going to be? It's going to flex our arm at our shoulder joint, right? That makes sense because of where it's originating and inserting. And then it's also going to medially rotate the arm. And all of that makes sense. Like if you connect all the dots and you think about where it is, where it's inserting, where it's originating, its name, all of those things for various muscles, it can really help guide you to connect all the dots. Okay, so the last one that we're going to label on this image is going to be the latissimus dorsi, right here. The latissimus dorsi inserts on the humerus, and it has various actions. It adducts, and so we know that that's going to be moving toward the midline. So it adducts the arm toward the midline at the shoulder, and that makes sense because it's inserting on the humerus. So that's how it can adduct the arm at the shoulder. And it medially rotates the arm at the shoulder, which makes sense because it's inserting on the humerus. And it extends the arm at the shoulder. Okay. Moving on. If you don't have your bearings, go ahead and get them and come back to us. So, I don't know why I'm saying us, me. Come back to me. Okay, so we're looking at a ventral or anterior view of the trunk, right? So, a great example, we just identified the deltoid from a posterior or dorsal view. And again, here we can see the deltoid, but this time it's from a ventral or anterior view. So we have the deltoid there. The pectoralis major and pectoralis minor, actually I think the pectoralis major is on your muscle practical, not the pectoralis minor, but the pectoralis major, it was not practical for me to white that out to reveal it, so I will go ahead and highlight it in yellow here. Here is your pectoralis major, and I always think that on like old movies, I don't know, like Baywatch and whatnot, I feel like the commentary is always like men working on people always say like the men are working on their pecs and whatnot. So pectoralis major and their pecs, it's their pectoral muscles, is what they're working on when they're trying to increase their chest size. So that's how I remember that. Anyways, so we will go to the upper extremity on the right side of the body here, and we will label the biceps brachii right here. We'll stay on the right side of the body, and we will label the external oblique. Shift over to the left side of the body. We have the pectoralis minor labeled, and we'll go ahead and we will label the serratus anterior. We can label the rectus abdominis, or your 8-pack, right? And we have your internal oblique. In this particular image, we cannot see your transverse abdominis. I'm going to go ahead and make a table. I may or may not have already made this table with you. I think it's a great way to try to remember your external oblique, internal oblique, and transverse abdominis. So we'll go ahead and we'll put location, muscle, and direct, that's an R, directionality. Whoops. I apologize, I'm not sure what I did right here. I guess I need to pin my toolbar back down, maybe. Okay, that was an interesting little thing I did there. Draw, whoops. Okay. All right, and we're back. I apologize about that. Okay, so directionality of your fibers. We're referring to muscle fibers, of course. Okay, so the most superficial is going to be your external oblique. The middle man there is going to be your internal oblique. And your deepest is going to be your transverse abdominis. really hope this pen is at least getting my point across. I know it is not ideal. Okay, so directionality of fiber. So when you're looking at the muscle, you can actually tell which muscle is which based on which way the fibers are going. So especially if you have a model where your abdomen pops off and you're looking at your external oblique, your internal oblique, and your transverse abdominis internally, like looking deep to superficial, if that makes sense. Looking at the directionality of fibers is helpful. It's also helpful looking at it from this view. But so my point is that the external oblique fibers are going to go lateral to medial downward. So we're gonna be going lateral. My, lateral, there we go, to medial, and of course we're going to be headed pointing downward there. Okay, and then the internal oblique is going to be headed medial to lateral downward, so the opposite of the external. And your transverse abdominis, which is going to be your deepest, is actually going to be horizontal fibers. So we will move on. Okay, if you haven't already gotten your bearings, please do so now. We already labeled these muscles on another image earlier. We're going to go ahead and do it again. So you see your spinous process of your scapula. Use that as your landmark so you know what is above and below it. You know that above it is going to be your supraspinous fossa, which means that your supraspinatus muscle is going to be right here. And we know that below your spinous process is going to be your infraspinous fossa, which means that your infraspinatus muscle is going to be on it right there. And then earlier we addressed your teres major and your teres minor. So which one is superior and which one is inferior. So your teres minor is superior, your teres major is inferior. There we go. I hope I just said that right. Teres minor is superior, teres major is inferior. I can't remember what I said, but I said that correctly earlier, I'm sure. Okay, and we are looking at a, as far as your bearings go, this is the posterior view of your scapular region. Okay. Here we are looking at the posterior view of your right upper extremity. So if you're wondering why this is your posterior view, it is in relation to the anatomical position. So when you're in anatomical position, your palms are going to be facing anteriorly, and the back of your hand is going to be facing posteriorly, in which case your ulna will be at your midline, or closer to your body, and your radius will be lateral. So here we are looking at the posterior view. So we are not in anatomical position. And this is your right upper extremity. Okay. So we'll start labeling. We have your, and you know what, actually I think before we start labeling, we're going to go ahead and make note that your ulna is over here and it's your radius. My goodness, I'm on a roll of making some technological issues happen today. Radius. Oh my, okay, hold on. Okay, well, we just know, I guess, if the ulna is here, then we know the radius is on the other side. Okay, so we have your extensor pollicis brevis, and then we have your abductor pollicis longus. So if adductor, ADD, is moving toward your midline, your abductor, ABD, is moving away from your midline, okay? Then we have your extensor carpi brevis and your extensor carpi radialis longus. So carpi referring to your carpals, radialis referring to your radius, right? So next we have your brachioradialis. If you had that name, you would know which side it was on. You know it's going to be on your radius side, right? Radialis, referring to your radius. Move to your upper arm. We have your brachialis. And we have your biceps brachii. Okay. So we're going to head to the ulnar side of your arm, okay? Medial side. And we will label your extensor carpi ulnaris and your extensor digitorum. Okay, so it might be nice to note, headed from your ulnar direction toward your radial direction, so we're headed medial to lateral, right? You see how you have your muscles labeled ulnaris on your medial side because of your ulna, and you see all of the radialis on your lateral side because of your radius. I hope that that is making sense. And I kind of like to remember that the extensor digitorum is posterior, and it is kind of visually in the middle. Lastly, on this drawing, we have your triceps brachii. Triceps, tri, right? So the triceps brachii has 3 branches. I don't think you need to know them all for this practical, but just be aware of it. And we have your deltoids. We've labeled your deltoid in various different images now. Okay, so here we're looking at the anterior view of your upper right extremity. I think that many students prefer to view the muscles from this. They prefer to label the muscles from this view because in your arm, they're nicely lined up from an anterior view. They're just kind of parallel, they're easy to look at. It's a nice view. It's an easier view than the posterior. So maybe try to get the anterior view of the arm down very well and then flip it over and look at the posterior view. But you should definitely know both, because you don't know which way, for the muscles that you can see from both directions, you don't know which way your professor is going to ask you to label it. So if you can see the muscle from anterior and posterior, definitely know how to identify it from anterior and posterior, not just one way, okay? All right, so we will go ahead and note that our radius is here. Our ulna. Oh my. Okay, so our radius is here, so we know that ulna is on the other side. I apologize every time I try to get a little closer. Or maybe if I do this. Okay, we'll see if that helps. Every time I try to get a little closer, it minimizes my screen. Okay, the ulna is going to be on this side. So that's how we know that we are looking at our right upper extremity anterior position, right? Okay, so on the ulnar side, we're going to have our flexor carpi ulnaris. Okay. Just next to the flexor carpi ulnaris, we have our palmar longus. Okay. Lateral to the palmar longus, we have the flexor carpi radialis. Lateral to the flexor carpi radialis, we have the brachioradialis. Right? We're on the lateral side now. So we went from medial to lateral, or from ulnar to radial. Okay. Then we have our pronator teres, a little higher up here. We have our biceps brachii. We have our triceps brachii. We have two triceps brachii labeled here. We have the medial head and the long head labeled. So we have medial head, long head labeled here for our triceps brachii. So triceps 3, right? And actually on the last image, we had our triceps brachii lateral head labeled. So now we have labeled all 3 of the triceps brachii heads, okay? We will label our teres major, and this is from a different view. We've labeled our teres major a few times now, but not from this view yet. So there's a teres major. We know our teres major is what to our teres minor? Inferior, right? And we have our subscapularis. Makes sense because we're looking at our scapula. Okay, here we're looking at the anterior view of the upper right extremity. So if we're looking at the upper right extremity, an anterior view, that means that this is going to be our radial side, right, which is lateral. And this is going to be our ulnar side, which is medial. So as far as what we just labeled before, what is that going to mean for us? That's going to mean that this is our flexor carpi ulnaris, right? We're on the ulna or medial side. What did we say was next to our flexor carpi ulnaris? Our palmaris longus. And if you follow that down, it's long and it goes to your palm. So just follow it down, palmaris longus. It makes perfect sense. Lateral to our palmaris longus, we have our flexor carpi radialis, right? Now we're on the radial side. And lateral to our flexor carpi radialis, we know that we have our brachioradialis. And a little higher up, remember, we labeled our pronator teres. So just another practice of the same type of view. Moving right along, I believe we have 3 more images. So here we are looking at a posterior or dorsal view of the trunk. a little bit of the proximal portion of the lower extremities and some of the upper extremities as well. So quite a few different things labeled in this image. So let's go ahead and find our kite. Okay, we know our kite is our trapezius, right? And we'll go ahead and find our latissimus dorsi. Earlier we talked about it and how it is involved in arm movement and the humerus, right? So here's our latissimus dorsi. Earlier we also labeled our gluteus medius in the image where the gluteus maximus was not visible due to the sciatic nerve. But here in this image, we actually can see both the gluteus medius and the gluteus maximus. So here we have our gluteus medius, and we'll review our gluteus maximus there. We've labeled our deltoid a number of times now. So here is a view of our deltoid. And then you see that we have, up by our scapula, you can see the numbers 1, 2, 3, and 4 on the muscles themselves. So there's a little legend down here. I like how this image was labeled. I was happy to have found it. I apologize, I dropped my pen. Okay, so we should very well know what these muscles are by now because we talked about our scapula and our fossas and where these muscles lay. So we know where our supraspinatus muscle is and our infraspinatus muscle is in reference to our spinous process of our scapula. So you can see the spinous process of your scapula there in the image. You're looking on the left side of the body. Here it is right here, spinous process of the scapula. So that makes number 1 your supraspinatus process. Or, I apologize, your supraspinatus muscle, not process. Supraspinatus muscle. That makes number 2 what? Your infraspinatus muscle, larger than your supraspinatus muscle. And if we look at number 4 and number 3, we know that your teres minor is superior to your teres major. So that is going to make number 4 your teres minor, and number 3 your teres major. Okay. Travel down here to the next image. So we are looking at an anterior or ventral view of your trunk. Okay, so earlier we were talking about your pecs, or your pectoralis major, your pectoral muscles, right? So if we are looking at here we have, I apologize, the left side of the body and the right side of the body. So we'll stay on the right side here. And we have your pectoralis major, superior and lateral to your pectoralis major. We have your deltoid, right? We've labeled that so many times now, so we should be comfortable with that. If we head toward your midline, we see your linea alba, and we know that we're going to find your rectus abdominis bilaterally around that, right? So your rectus abdominis, let's find that arrow there, there it is. Your serratus anterior, we can find that just near your pectoralis minor, also labeled earlier. Okay, let's talk obliques. So your external oblique, which direction are your fibers going to go? They're going to go lateral to medial in a downward direction. Here are your external obliques. Your internal obliques, which direction are your fibers going to go? They're going to go medial to lateral, right? So there we go. We had our little table from earlier. It's helpful there. We have your external intercostals and your internal intercostals. So on the muscle, or on the muscle model that you have, that I have seen in your lab, I don't believe you're able to see your external intercostals on it, but you are able to find your internal intercostals on it. So I apologize, I dropped my pen. Again, goodness, I may need to pause. I apologize. I apologize. I'm not able to find at the moment the little tip that goes on my pen that allows me to write on my touchscreen laptop. So I'm going to attempt to use my finger, but it may be kind of messy. So I apologize, but hopefully it will do the job. So we were labeling our internal intercostals and our external intercostals is what we were doing. So we have our internal intercostals and our external intercostals there. So we'll go ahead and come down to our last image. We're of course looking at the face, right? Anterior view. So if we go ahead and just start superiorly and head inferiorly, we have our frontalis muscles. Okay. We have our temporalis muscles. We have our orbicularis oculi, and I always remember that by oculi. So eye, referring to the eye, right? Oculi. Orbicularis oculi, what's that going to do? It's going to close our eyelids. Also, go ahead and note that the facial muscles have one function. So if the orbicularis oculi closes the eyelids, it does not also open them. There is another muscle to open them. Okay, so just note that. They don't do both. They won't open and close. They'll do one or the other. Okay, so let's go ahead and find, earlier we mentioned our zygomaticus minor and our zygomaticus major. So we know that our zygomaticus minor is actually going to be superior to our zygomaticus major. So here we have it. So zygomaticus major and minor. We have our orbicularis oris. So we're around the mouth. It's going to close and pucker the lips. Okay. We have your platysma. Your platysma is going to be a very large superficial muscle. I remember it. It's large and flat platypus feet. That's how I remember it. It depresses and wrinkles the skin of your lower face and mouth. And it also assists in forced depression of the mandible. That is what the platysma does. It's action. What else do we have here? We have our masseter. What does our masseter do? It works in bilateral contraction and elevation of the mandible, i.e. it raises the lower jaw when you're trying to close your jaw. So where is it? It's bilateral, like I said, it's on both sides. Masseter right there. And of course it will be on the right side as well. We have your buccinator to compress your cheeks, right? It's deep. And one that isn't labeled, that I wish was, and I very much so wish I had the tip of my pen, so I will attempt to write this with my finger. It may be a disaster. Your sternocleidomastoid. So no arrow there. So I apologize. Cleidomastoid. you may see that labeled on diagrams as SCM also. Okay, so that will conclude our review of the muscles. Like I said, please contact me, reach out to me if you have questions, comments, or concerns. So thank you and happy studying. I hope this distance tutorial was helpful.